and then I got even an interview when I did my USMLE Step 2 CK examination. So I did it kind of backwards. So I did Step 2 first, and then I did Step 1, and then I went back and took clinical skills. And after I completed my residency, I did the Step 3. Step 3 was required from me to take because you cannot sit for the American board examination before that. So and I did the hands-on clinical experience. It was not in the United States, but it was in North America, so Canada, and University of Toronto is one of the biggest, or probably the best medical school in Canada, in the 16th medical school in Canada, and it was a great experience. So next step that you need to do, if you are interested in getting a residency, to pursue residency in the United States, this is probably the time to explore which one or which examination you're supposed to take. So USMLE Step 1 versus USMLE Step 2, and then do whatever comes up next. Okay, so I will finish right now. Now it is time for us to take questions. So let's start by question. Oh, all of these are really good questions. Okay, so let's start by the first one. What is the best period to prepare for the USMLE? I am an intern, and it is my 4th rotation right now. Okay, so period, that's a very common question. It's an excellent question. However, if, let's say, for example, anonymous attendee number 1, let's say, for example, you graduated with honor degree from your medical school. You are an intern, so you finished the basic medical science and you finished the clinical science. Period can range between 2 weeks and 2 years, right? It depends on how much can you recall from the residency that you did in back in how much knowledge can you retain and can you recall. If you are a smart person, if you are, for example, have a photographic, super smart person with a photographic memory, you might not need that much of a time. Some people, I have seen people, actually not here, but I've worked with people who did their revision for the USMLE in probably 2 to 3 weeks only 2 to 3 weeks. Why? Well, because they already know the knowledge. The knowledge that they take back in medical school is the same that they are going to get tested on. So period, if you're talking about how much time do you need, this is the answer. The answer is it depends. How much can you recall and how much can you retain? If you're talking about what is the timing of taking the USMLE, well, the timing is when you are prepared. When you are prepared, when you are fully prepared, when you do, for example, when you study the USMLE Step 1, you do, for example, this is one of the commonest book or one of the most successful review books that I have used in the past when I did my review. So if you actually finish this book, for example, finish 2000 MCQs, for example, and you are scoring high, and you can guarantee that you are going to score high. And by the way, USMLE is changing into 2021 from, instead of scoring a number, it's a pass or fail. So what is the timing to take the examination? Is the answer is when you are fully prepared. How do you know you are fully prepared? This is actually going to require another lecture. So I hope I answered the question for the period to prepare, the time that you need to prepare for it, and the timing of taking the examination. Okay, so question number 2. I am a 6th-year medical student and I want to take elective in Canada and or US. how to apply and how many months can I take to consider as a clinical experience. So this is very ambitious to think about taking clinical experience. It depends. You want to take 2 weeks, 1 month, 12 months, as much as possible. I think the answer is you can take as much as you want, but at the same time, as much as you can, because let's say, for example, a resident wants to. I receive a lot of emails from people who wants to do their ER rotation with us at the National Guard Hospital. We cannot accept more than 5 interns per rotation, right? So if you are able to do at least 2 weeks of clinical experience, I think that is considered as a clinical experience. If you can take 1 month, it's okay. I know people who did 8 weeks of clinical experience in Canada, and then during the internship year, did a cardiology rotation in Mayo Clinic as part of their clinical rotation. So to answer the question, it seems like this question is, what is the minimum requirement? I think the minimum requirement, I don't think it's even a requirement. It's an optional thing. It actually boosts your application. So clinical experience is something that you need to do. The more you do, the better the chance, because it depends on how you perform in that clinical experience. You might actually do a clinical experience and actually miss things around and mess things up and actually give a bad impression, and actually they will flag you or blacklist you because, for example, of your behavior or of your weaknesses or so forth. So you want to do this as something optional and something but it's highly recommended if you are gonna give a good leave a good impression behind you. Okay, all right. So the next question, Jayan. Okay, where can I take the USMLE examination in Saudi Arabia? Up to my knowledge, I don't think there is a prometric center that conducts USMLE in Saudi Arabia. You can take it in Dubai, you can take it in Jordan, I guess. I'm not sure if, up to my knowledge, I don't think there is any center that you can do the USMLE examination in Saudi Arabia. If you finish the Saudi Arabia, if you finish the USMLE preparation, taking the examination or the location of taking the examination is not that difficult. You can just fly out to Dubai, for example, and take the examination in their prometric center. Or if something actually comes up, or you look it up and find out that it is available in Saudi Arabia, it's fine. Okay, I don't think it's a problem. For example, let's say that yes, I did the preparation and I want to do my residency in United States. I don't think it's a difficult thing to go to United Arab Emirates, Dubai, for example, to take the examination there. 2 days, you fly out, you take the examination, and then you come back. So it's something that depends. So yeah, one more thing to clarify. USMLE step 1 needs to be taken. It can be taken anywhere around the world, right? Including Saudi Arabia if it is available here. USMLE step 2, clinical knowledge, the CK, can be also taken anywhere in the world. The clinical skills, actually, you have to take it in only 5 centers for the USMLE around in the United States. So Los Angeles, where I took it, Philadelphia, Houston, and I forgot the other 2. Okay, want to ask about age limit for application. You mentioned no. This is so no. 35 is not. There is no age limit. I don't. One of my medical students, when I was a senior resident, or maybe an R2, so mid-level resident. I had a medical student who was 40 years old, who was still in medical school. He was graduating that year, so he was a senior medical student who was 40 years old. The thing is, in the United States, when they pursue medical school, they actually do it as a post-grad school. So they do certain degrees. For example, they can study engineer and then they pursue residency, and they pursue medical school. And medical school is not cheap, so some of them actually have to work as an engineer, or in this case, this person was a dancer. He was a dancer in a band, so he used to travel all across the world to perform. And then when he was able to provide the tuition fees to attend medical school, he actually attended medical school. So he started residency at age 42. Okay. Do we need to do research in the USA for matching? Well, you don't have to, but it is highly preferred. For example, you and Dr. Mustafa both applied for residency. Both of you have US clinical experience. Both of you scored high in the USMLE, scored the same score in the USMLE Step 1 and Step 2. But you have a research and he doesn't, or you have two researches and he has one, or you have a very strong research or a very good publication and he doesn't, or he has a publication in the specialty that he's interested in and you don't. So they will take you over him, or they will take him over you. So this is another thing. Does GPA matter? Well, GPA, your GPA, again, it's a matter of it's one of the objective matters that they evaluate you. But however, let's say that your GPA is only 2 or it's 5, right? But your USMLE score is not, your GPA is high, but your USMLE is not that high. They will actually depend and put more weight on, they will put more weight on the USMLE scores over the GPA. Let's say Dr. Rawan did, for example, scored, had a GPA of 3, but scored 260 in USMLE Step 1 and USMLE Step 2. And you have a GPA of 5 out of 5 or 4 out of 4. But you scored, for example, 190 in the USMLE. They will take her over you because of the USMLE scores. They will rely on the USMLE score more than they will rely on the GPA, because they don't know, actually. They cannot tell for sure. Maybe your medical school, maybe you studied in a school that nobody is actually getting honor degree versus another school that they will give honor degree to everyone, right? So yeah, it does matter. Actually, you want to maximize your chances across the board. You want to get a very high GPA and you want to score very high in the USMLE examination. Okay. How to get an elective rotation and who pays for it? To take an elective rotation, you need to contact hospitals. Go to their websites, go to the medical schools, get the contact information. For example, you want to do emergency medicine, get to the emergency medicine website of that residency program or that university, and start contacting them. Ask them how can I do an elective rotation, for example, in your hospital or in your department? Who pays for it? You do. You pay for it, right? You will have to pay for the ticket. You will have to pay for, if there is an application fees, you're gonna have to pay for your living and your expenses when you do it over there. And it is worth it. It's worth it if you are able to leave a good impression and then secure a residency there. How did you manage to balance between studying for the USMLE and studying for school work? Well, that's an excellent question, because when I did my medical school, I tried to do my residency. I tried to do my USMLE during medical school. However, I was not able to finish it. And the problem is two things. Number one, I graduated from Taiba University. The problem with Taiba University at that time, it was not listed in a list called FAMER. So FAMER, which is the Federation of International Medical School, something like that, it was not listed. So when you go and apply for the examination, when I went and applied for the examination after 4th year, I could not. They said, "Well, your school is not registered, so you cannot sit for the examination." So I had to go back and talk to the dean that listen, our college is not listed in the FAMER, so it needs to be. So they actually did apply to get that school accredited with the WHO and the FAMER. And then after that, when I applied, the medical school actually shows up in the list. So let me give you an advice. You don't want to, for example, prepare for the USMLE while you are a medical student at the expense of not passing medical school, right? You don't want to study USMLE and then keep studying on USMLE, and then at a certain point you don't even pass your exam in the school. Number one, you need to graduate from school, right? You need to graduate from College of Medicine. After that, you can sit for the USMLE, because you cannot apply if you don't hold the certificate of the Bachelor of Medicine and Bachelor of Surgery, right? The MBBS degree. After that, yes. So if you want to balance it, number one priority is given to pass your year 1, year 2, year 3, all the way up to the 6th year. You want to do that. If you are able to manage to incorporate USMLE into your studying, that's good, really excellent, right? Because you don't have to spend a lot of time like I did. What I did is that the chance that I was given is that Ministry of Education at that time actually told us, you know what, go and just, we're gonna give you money, we're gonna give you living tickets, everything, just study for USMLE. Okay, you are the situation is a bit different right now, so you probably are required to do it while in medical school, right? So it is a bit difficult. It was a bit difficult for me. I'm not sure how much can you do at that time. Okay, as Saudis, do we compete for seats which other? What other Saudis? Right. So yeah. So in the chance that I was given, yes, we used to compete with each other. For example, University of Maryland do 12 residency program. 12 seats for the residency program for emergency medicine. The Saudi Cultural Mission actually were able to sponsor an additional seat. This additional seat, it's not open for the Americans. So we were competing with each other. So for example, I applied in 2010, and then only 8 other people applied for that. So I was only competing with 8 people, right? But this was in the time of affiliations. Now, this can continue. It's there. But because of the change in the market and because of the availability of residency here, Ministry of Education is not doing the same right now. However, you can apply to the general pool. You can compete with the Americans. A couple of my friends actually were able to get residency and get accepted in a residency program, even surgical residency program, without even the help of the Saudi Cultural Mission. You can help yourself. You can apply as the other international medical graduates. So residency program seats in the United States probably 30,000. The US medical graduates only takes up 20,000. 10,000 seats are occupied or taken by the international medical graduates from China, India, Europe, all over the world, the Middle East, it's like all over the thing. The system over there is actually a system that depends on the foreigners or international medical graduates. So yes, sometimes you are guaranteed, you have this, for example, 13 position, 13th seat is guaranteed to be taken by a Saudi. Okay. However, if they don't feel that, well, let's say 10 people applied for that position in emergency medicine at University of Maryland, but they did not like any of them, it's not going to be given to an American applicants. It's not going to give it's going to go vacant. It's going to stay vacant. Or if they like, for example, 2 people, they will only take 1. Or if they like all 8 people, they have only the option to take only 1. Okay, there is a new protocol. Yes, we mentioned that it is going to change the USMLE only. Yeah, at a certain point it's going to be pass or fail, so that's going to be different. Okay, how do I need to do step 2 before 1? Yes, so as far as I know, and this is a personal experience, I did step 2 before step 1. Why? Because I did step 2 after I finished my internship year. So I kind of forgot all about step 1. So it was difficult for me to go back to USMLE step 1. And I just finished my internship year, so I am able to manage my clinical knowledge. So I started studying by step 2 because it was available in my head. And I had to kind of just review it and then take the examination and then go back to USMLE step 1. So in 2010 it was different from now. Yes, you can apply with 1 step. You can apply, provided that by the time that you get the interview or the time that you start the residency, you actually have finished everything, because you cannot start residency unless you are ECFMG certified. Meaning of ECFMG certification is taking step 1, step 2 CS, step 2 CK. Okay, is it okay to take step 1 after 4th year? Actually, it is the best time to take it if you are fully prepared after 4th year. 4th year, I'm assuming that you are in the classic system, so that means you are finished all the basic sciences, so pathology, biochem, pharmacology, and everything. Yes, the best time to take it is probably 4th year if you are in the classic curriculum. Okay. Okay, so the question again, there is a new protocol, examination step 1 only, you need to pass it. Is this a positive point or against us? Well, it can be both, because in the past, as we said in the GPA question, they actually can compare people with each other based on your score. So, for example, Hassan scored 260 in USMLE step 1. Dania scored 250. So Hassan is going to be better than Dania, for example, right? Because the number is different. However, when they change it to pass or fail, they'll have to take a look at the other parameters. So the question still remains: is it a positive point or a negative point? No, it can be either, because maybe they are maybe to pass you need to score really high to even pass it. So it can be against us, right? But it can be a positive as well, because you know what, you don't worry about scoring a certain number, you only need to pass it. So it can actually be both. How difficult is it to get acceptance without affiliation? Well, it is challenging. We're not going to say difficult. We're not going to say impossible. It's a challenging procedure. It's a challenging process. The thing is, it depends on the specialty. For example, your chance of getting accepted in internal medicine is way higher than getting acceptance in ophthalmology. So if you are really passionate about ophthalmology, maybe you're better off applying here in Saudi Arabia than over there, because the chances here is probably better than there. Okay. Can I take step 1 at my 4th year of medical school, or after graduation will be better? No, it depends. It depends. The best timing is to take it when you are really fresh and fully prepared. Maybe you are fresh but you're not prepared, so don't take it. If you're not prepared, do not take the examination just to try, because anytime you fail the examination, it will be recorded that you failed the examination. Okay, so you don't go to the examination and then you feel, well, listen, the exam is too hard, I cannot do it. Let me fail myself and then I will come back later, I will prepare and do this. No, the best time to take it is as soon as possible, as soon as you finish the basic sciences and when you are fully prepared. طيب. How can I get an official observership? I think it's I'm a medical student at basic years. I don't so I wouldn't recommend to go to do observership when you have not done any clinical years. I would recommend that to do clinical years, you need to have some sort of clinical experience. Clinical experience meaning know how to take history, introduction to internal medicine, and so forth. So it is better if you take it when you have some clinical experience, because you don't want to show up there and then when they ask a question, you have no answer or you're clueless. طيب. Barometric or USMLE is available in Riyadh. طيب. Okay, well, this is a good update. So take it from Mustafa. Mustafa is saying that it is available in a Barometric center. So Barometric center is here, is available in Saudi Arabia, but the question remains: is it does it provide or does it host the USMLE? It looks like it does. Do you recommend Kaplan as a resource for you to pass USMLE? Yes, I did Kaplan. Kaplan is a great resource. Well, it is it's expensive. Well, I don't want to say it's expensive because you cannot put a price on it. It cost money. Alhamdulillah, at that time when the market was demanding a lot of physicians at that time, Saudi Cultural Mission actually paid for it. Okay. طيب. What is the good step 1 score to match an ER? The highest possible. Cannot put a number on that. What is the privilege of US board in Saudi? Well, now if you take your residency if you take the Saudi board or if you take the American board, okay, and you come back, most hospital will hire you because you have either the American board or the Saudi board, okay? Most hospital will pay you the same. The difference is in some hospitals, they still require that you take that you need to be a North American trained for some reason. They think American board is better than the US, the Saudi board. Is that true? I cannot say that. I can't say that because I did my residency in the United States, so I will say yes, it's an excellent residency program. I did not do my residency here, so I cannot say no, it's not. It's a bad one. I have colleagues from American programs who are excellent. I have colleagues who are average, and I have also colleagues graduates from the Saudi board who are extremely excellent, who are like really great. But now the question is, if you have a chance, a 50% chance of getting accepted in the Saudi program, but you have a higher chance of getting accepted in the United States. Let's say that you apply and you did not get matched for the Saudi board. What is your next step? You have to have a backup. Can you have a US residency program as a backup? Yes, of course you have. It's not a matter of which one is better. It's a matter of having options. Sorry, but do you mean that because No. You don't have to pay for it. Let's say, Athir, let's say that so doing an elective rotation is different from doing a residency program. If you are doing a residency program, you will be paid. You are actually an employee of that hospital. They will give you money. They're not going to take money from you. They will give you money, so you are being treated as anyone else in the residency program. You will be treated exactly like the US, the American citizens, right? They will pay you money. It's not, no, you are studying. No, you are doing training. You're not studying. You are doing residency training. So you're providing services while learning. So they will pay you money. Question from Dr. A. Should you study an SMLE or USMLE first? That's an excellent question. SMLE focuses on the clinical sciences, right? They will test you in internal medicine, OB, surgery, and so forth, right? So why don't you study for both at the same time? Study for USMLE Step 2 and SMLE, right? Because you are actually reading the same curriculum. Doctor, in my basic year in college, I am in my basic year. Okay, next year will be my first clinical year. I was wondering. Well, so my advice to you, anonymous attendee number 0204, my advice to you is it depends on the specialty you want. For example, let's say that you are interested in internal medicine. Internal medicine is easier than taking USMLE step. It's easier to get to pass it. To get accepted in than مثلا ophthalmology. So if you're interested in ophthalmology, for example, no, you know what? Put USMLE on the side and do clinical experience, do researches so you can get accepted here, for example. But if you're planning on doing internal medicine, for example, internal medicine is a bit easier, so focus on USMLE. طيب, how did you prepare for USMLE Step 1? Well, I studied this USMLE Step 1 first aid. I watched the lectures and the online lectures and the live lectures of USMLE Step 1 in Kaplan Medical, and then I did maybe about 5,000 MCQs to prepare it. Yes, Dr. Ammar. طيب, جزاك الله خير يا مصطفى. يا سلام. طيب يا أخي, يعجبون الناس اللي they have your back. طيب, تسلم يا مصطفى. Can I apply to be a doctor in the States with the Saudi board? No, you cannot. You can do additional residency. You can apply for additional training. For example, you did internal emergency medicine or you did internal medicine and you want to pursue critical care fellowship. Yes, you can. Your fellowship, your American board certification is enough. However, in certain hospitals, especially, I think in all hospitals in the United States, you cannot practice. You cannot do clinical practice without. You cannot do clinical practice without you taking USMLE. So let's say, for example, you did USMLE Step 1 after 4th year. You did USMLE Step 2 after 6th year. Okay, you did your clinical experience and everything, and then you applied for residencies in the United States and you applied in Saudi board. For some reason, you did your residency in Saudi Arabia. You wanted to stay with family or whatever, or you preferred that you take your residency in Saudi Arabia. Did the preparation for USMLE Step 1 and 2, did that go to waste? No, it did not go to waste. Why? Well, because when you do take this examination, you are opening doors for yourself to pursue fellowships after that, right? Because, for example, in National Guard, they are really encouraging you after you finish the board to take to go abroad and do a North American fellowship. So it is still required by certain hospitals. They want you to take some additional experience or get exposed to a different experience. Okay, not necessarily better. Maybe it's not even available. Okay, so it is here. So it's something that it will benefit you. One, two. The other thing is that. The knowledge that you get from the USMLE is great. It does not matter the steps. Okay. Did you use flashcards method? No, I did not use that. But I'm not saying I did not use it, so it's not good. I watched the lectures. I read the review books of the Kaplan Medical, and then I reviewed the USMLE first aid, and then did about, as I said, I think 4,000 or 5,000 MCQ questions. Okay, so with that, I will have to end this. It was actually lovely to have you here, and it was great to see you all and to answer your questions. طيب سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك. Signing out.